Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. The Samskara is removing our old bad habits and inculcating a good ones in us. And today we have none other than Dr. Parimala Devi, who spoke about Samskara last time. And now she is going to talk about robotic surgery. One is the root of the root cause, and other one is the like a new spring sprouting. That means anything to grow, you have to have the good roots as well as the good spring and the sprouts or the chigru. And today she is going to come from Garbha Samskara to the robotic surgery, and she is a renowned gynecologist, obstetrician, and expert in colposcopy, and set a world record, and she has got a Guinness World Record in scanning or screening the cervical cancer. But today she's going to tell us how the robotic surgery is done. What is robotic? We all know that the Japanese and Chinese and they all have robots for everything, including the household things. But today, what role the robotic surgery has in the gynecology, she's going to tell. Parimala, welcome to our show, and we are very, very eager to listen to you and know the new technology. Please go ahead.
Thank you, madam. Thank you, madam, and respectful pranams to you. You have been my teacher, always a teacher. I admire you for all your this spread of knowledge. I go through your channel again and again whenever I am free because so much is there the knowledge. Hare Baba, I have to take little bit like that. It is a wonderful channel. I can say not to praise you in front of you. It is a wonderful channel because it suits every category of individuals, whether they are elders, they are youngers, or they are very much not knowing anything what's going on in this world. And thank you for welcoming today for this most advanced part of the technology which is going on in our country, that is robotic now. Why speaking about robotic is like when somebody comes to me and ask about some surgery or something, I will have to tell first in my role how it is connected. So usually we tell them, see, there is a surgery. I am a gynecologist basically. They may ask for some hysterectomy or they may ask for some tumor removal or something. They may come. Already they are worked up. They know what they have. That time we usually tell roots of surgeries. Before about 3 decades ago, it was only open and open surgeries only. Any surgery, surgeon have to open abdomen, whether vertically or transverse, depending on the disease, and they have to do. Then came that commonly called current operation, that is laparoscopy, that is endoscopic surgeries, where that madam also used to do in cardiology. So in that, just with this minimum incision, minimal access surgery, we call it as. With minimal access means we are accepting that and we are entering the body and trying to take out the disease. Then now these days, since about 2017-18, some great revolution happened, that is robotic surgery.
Okay.
Now, for all of us, it was fun like few years back. Robotic means, oh, there will be something. We need not do anything. Robot will come, it will touch, it will tell, it will go. And in some movies, at least, it was a great part of fun, like James Bond coming and robot giving him this one, scissor, go, hit that enemy. All these things were, we enjoyed. We enjoyed in our youth. And again, there was one robotic restaurant in Bangalore. I don't know whether people have this one.
I know.
There was once I went with my one of the girl secretary.
And those kind idli are served by the robot.
Yes. No, now it is closed, madam. Actually, it should have been there now. Hope they will come back again. Two robots, they used to come with the plate like this and come and stand. We have to take that plate, then it will just turn and go off. It was a fun actually. So like this robot.
Parimala, you are talking about the restaurant. I went to a school, and the embassy school, the robo came and gave me the flower. And the boy who had made the robo, he was behind the robo. And even children are so much engrossed. I think this Atmanirbhar Bharat is going to come out with the plethora of all the new ideas, and then the robotic surgery also will be advancing.
Yes.
Okay, go ahead.
So as we are speaking about not only human intelligence, what you have, what I have, it's all the part of the artificial intelligence, which is the hype now. Like sometimes one side we are proud of that, and another inside we are scared of it. because
Yes.
where is the end we don't know. So we have to use it, especially you were telling
Judiciously.
of your talk in the war it
Judiciously.
is used.
Hmm.
In the war
Yeah.
also it is used. In
Yes,
the
yes.
war, if they use it, at least the human life can be protected. But
Same.
they
Yeah.
can do any trick. They can kill or they can destroy, they can do anything. So
Yes.
the technology is to be used with safety. So when it comes
Yes.
to gynecological section, I am telling you now, and there
Hmm.
is a Da Vinci technology which is used. Da
Hmm.
Vinci was the person like he first started in USA this artificial
Okay.
intelligence with this one in I think November 22 it started this
Okay.
GPT and all. So
Yes.
like that into when they came with this operative robotics which we are
Hmm.
using. First,
Hmm.
it was actually Bangalore. We should be proud that Narayana Health had the
Hmm.
robotic surgeries first starting, like as I have heard.
For
If
the
I am
cardiac
mistaken,
surgery. Yeah.
I think I am not mistaken. Then we used
Hmm.
to hear, oh, Narayana has a robotic, what to do like that. Then Fortis also tried to buy
Robot.
some one robotic surgery, a surgical instrument came, 18
Hmm.
crores. It is not a
Hmm.
simple thing,
Oh.
18 crores. Da Vinci.
Okay.
Da Vinci's
Okay.
are the finest in that because they have the highest technology. That too, we have
Okay.
excess technology, yes, technology. In that, there are
Okay.
types. So, what happens in robotic is usually the precision of the incision. See, it is all nothing but these days are we were not supposed to do a big incision. The cosmetics, the blood loss, and the tissue dissection, everything counts for a surgeon. Like just
Okay.
because you can do, we cannot just haphazardly open and take out the tumor with 5, 6 bottles of transfusion we have seen
That
in our
that
days.
that will spread the disease.
Disease also.
If they meddle too much and then handle too
Yes,
much and put their
yes,
hands,
yes,
the
yes.
cancer cells will spread. So yeah.
Dissemination of the cancer is not our motto. So here
Okay.
in robotic, what happens? A robotic means some of my patients who are very much known to me, they have become my friends now. What doctor for you? Now robot is there. You nicely go and take the money and robot will operate. Come. Amma Tayi, I will tell in my Kannada language, Namaskara. It is not like that. We have to be with the robot. Robot is nothing, it's an extended arms for the surgeon. There are some
Yes.
four arms which are like ನಾವೇನ್ ಹೇಳ್ತೀವಿ ನಮ್ಮ ವಿಷ್ಣು ಹಿಂದ್ಗಡೆ ಎರಡು ಕೈ
Yeah, yeah,
ಮುಂದೆ
the ನಾಲ್ಕು. Yeah.
ಹಾಗೆ
God
ಆ
used
ತರ
to have 4 hands. Yeah, God,
ಫೋರ್ ಹ್ಯಾಂಡ್ಸ್
goddess.
ಎಕ್ಸ್ಟ್ರಾ ಫೋರ್ ಹ್ಯಾಂಡ್ಸ್
Yeah.
ಯಾಕಂದ್ರೆ ನಾವು ಎರಡು ಕೈನಲ್ಲಿ ಹೋಗಿ
Yeah.
ಅಬ್ಡಮನ್
Two hands
ಓಪನ್
are
ಮಾಡಿದ್ರೆ
there. Yeah.
ಹೇಗೆ ಸರ್ಜರಿ ಮಾಡ್ತೀವಿ ಅದಕ್ಕೆ ರೋಬೋಟಿಕ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ಅಂತ ಆರ್ಮ್ಸ್ ಏನಿರುತ್ತೆ
So
ಅದು ಒಂದು
here, instead of putting 2 hands, you are putting the 4 hands.
four
Okay.
hands, four
Yeah.
hands through the
Okay. Okay.
instrument type. So those
Okay.
four are attached to the camera, which is already put in the with the minimal access
Abdomen.
incision toward the patient. When
Okay.
we and connect it and dock it, this word is
Hmm.
very important in robotic docking. ಡಾಕಿನ್
Hmm.
ಮಾಡ್ತಾ ಇದ್ದೀರಪ್ಪ ನಾವು ಬರ್ತೀವಿ ಅಂತೀವಿ ನಾವು ನಮ್ಮ ಟೆಕ್ನಾಲಜಿ ಪೀಪಲ್ಗೆ.
Okay.
ಯಾಕಂದ್ರೆ ಅವ್ರು
Okay.
ಅದನ್ನ ಡಾಕಿನ್ ಮಾಡಿದ್ರೆ ಅಲ್ಲಿ ಒಂದು ಸ್ಟೇಜ್ ಮುಗೀತು ನಾವು ಅಲ್ಲಿ ಹೋಗಿ ಕನ್ಸೋಲ್ ಕುತ್ಕೋಬೇಕು. ಸೊ ದೇರ್ ಇಸ್ ಎ
Yeah.
ಪೇಷಂಟ್
Tell
with
in
robot,
English. Okay. Yeah.
robot, and there is
Okay.
a patient is lying down on the operating table as usual with the
Hmm.
anesthesia, our respectful anesthetist team at the head end, and we
Hmm.
are at the main surgeon is operating at the console. He is little bit
Okay.
some 5 feet, 6 feet away from the patient body. So
Okay.
when this docking happens, when patient robot is connected to the patient body, then we can start using the instrument from here with a how we in the robotic. I
Two
mean to say
fingers.
video game with these clutches. We hold the
Okay.
clutches, just move with that. It is just beautiful to see the instrument moving in the patient body. So well,
Okay.
the technology is really, we have to appreciate the
Advanced.
brains behind this. So by
Okay.
doing this, what advantage? Why all this drama? Some people will ask. It is not drama. It is the necessity. Because we
Okay.
were in a era where there was no technology. Starting from Shushusha time, surgeries have been done. But
Yes.
now we want to give the best to our community. In
Patience.
that time,
Yes.
what we do, the incision should be small and the blood
Hmm.
loss should be minimum and the
Okay.
tissue should not be unnecessarily damaged. All
Okay.
these three things are taken care. And because of the robotic, this one, because the scissors, what we use is a very fine scissors, like how
Hmm.
the bird technology, like the
The
beaks of
beak. The beak. Hmm.
beaks of the bird. So the tip of the beak, it just moves like this. So the
Okay.
incision or the whatever the we are doing the tissue dissection, it's all
Hmm.
very less. And
Hmm.
another thing, what happens is like the blood loss becomes bare minimum because
Hmm.
even the small capillaries, small
Hmm.
arteries are also cauterized by using these small fine cauteries. And
Okay.
another thing like we are sitting and operating here in robotics.
Yes.
That is one
Yes.
advantage for the elderly surgeons. Actually,
Yes.
when we start using these clutches and all, the finger movements, if at all, normally we are doing some work, madam, like either you or do or
Yeah.
I do,
Yeah.
it's only like this. So, some great Bharatanatyam dancer is there, they may do a little bit more like this, but usually it is the 360 degree. That
Yeah.
360-degree movement is not there. But the
Okay.
robotic arm helps us, it does that 360 degree. You should see that big scissor, it will go like this, it will come like this. So because of
Okay.
that, we can go any depth of the tissue. If there is some
Mm.
cancer tissue bleeding, some hidden tumor is there, we can push it, we can take out that suction and
Mm.
everything. So it becomes more precise. So the
Okay.
precision of the incision makes the decision better. So decision,
Okay.
precision, both are very much involved with robotic. So
Okay.
the technology is costly, the insurances are working. The another advantage, the secret, other than the
Mm.
technology here is
Mm.
because robotic OT is something like it is a small jatre only in the beginning. There will be some four, five
Okay.
technical people for the docking, and there are three assistants at the patient side, and one or two
Mm.
surgeons at the console, like a flight, how two are sitting like one and one co-pilot
Pilots.
will
Like
be sitting.
pilots. Yeah.
Because if this surgeon gets tired, because sometimes surgeries can be 5 hours, 6 hours, the another
Okay.
surgeon overtake and they
Take
operate,
over.
start operate.
Okay.
That is one advantage. Another,
Okay.
when any human being, it is something like a birth.
Mm.
Commonly, what we tell is the yoga system.
Mm.
It is the birth, it is the
Mm.
growth, it is the
Mm.
decay, and then the degeneration and the death. These are
Yes.
the five phases of a human life. So when we
Mm.
come to this transformation and the elderly part of our life, we
Mm.
surgeons may get really burnout and we may start developing some of our
In
capacity
fact,
limitations.
when you become senior, you have a better knowledge about the anatomy,
Yes,
pathology,
yes,
everything is there, but
yes,
your body will not cooperate because of the tremors or weakness, or
yes,
you can't
yes.
stand for 5 hours, 6 hours, you get tired. So
Yeah, yeah.
then this will be
Yes,
useful.
yes.
Okay.
Because in laparoscopy also we stand. In open surgery also we stand. So in the
Mm.
robotic, what happens in front of the console, the surgeon is sitting.
Sitting.
So
Okay.
that makes them very comfortable. Without sitting,
Comfortable.
you cannot handle the console. You have to sit
Okay.
and touch your mata, whatever the forehead, to
Forehead.
those
Forehead.
sensors there. Sensors there. Then only
Mm.
the robotic will come to our help. Otherwise, he will tell, no, no. Mm, mm, That's a beautiful thing.
Okay.
So we have to
Okay.
put our head and we have to hold the clutch. Then our height also should be adjusted. Lot of technology is there. Whatever I'm telling is a very sample only. Then
Mm.
let's just start moving. Instruments start moving.
Mm.
Not that just because I kept the robot there, the instrument will move. No, everything is precised.
Yeah.
Everything is disciplined so that the safety of the patient is taken
Is
well into
important.
consideration.
Correct.
If at
Yeah.
all you have read somewhere that happened, this maybe a kind of negligence has happened. But commonly we are operating since 2018. It is
Mm.
really a very precise incision. And for the elderly person, 70, 75, like our madam, if you are strong and going ahead, that time the tremors which will come will be filtered by the robotic system. The
Oh,
technology is there. So if I am
okay.
trying to touch that blood vessel, then
Mm.
I may not be able to hold it like this. Like this, it may be tremors. But if at all the robotic surgery, if you are involving, then it becomes very strong. I can catch up that vessel immediately without any
Okay.
tremors. So this is one
Tremors.
very important technology. So because of all this, robot is taking its popularity, especially in cancer diseases,
Patients.
tumor
Okay.
removal, and the
Mm.
tumors are also removed not by haphazardly negligence. It is by the
Okay.
in-bag marcellation.
Okay.
In-bag marcellation.
Mm.
In-bag marcellation, why? Because the tumor you were telling in one of the this one should not be spread haphazardly to other tissues. So it will be
Okay.
totally concealed and brought
Yeah.
out of the body by a marcellation technique.
Yeah. It
Like
is
one
like a garbage being collected in the bag and
uh,
then peacefully removed without
remove
pilferage. And that is the
spillage.
one. So,
Yeah,
yeah.
without the
Thank you
spillage.
so much,
So,
Parimala
yes.
Devi, for a wonderful description.
Thank you, madam. You
I,
made me
I,
speak.
no, I enjoyed listening to you, and I'm sure everybody would be interested in knowing what is
Yeah,
robotic
I'm still
surgery.
still undergoing a lot of training in this. I'm a toddler
Okay.
robotic surgeon. Thank you very much for wishing
No,
me,
the
madam.
toddlers only will start running. So all the best for your marathon. All the best.
Thank you,
Thank
madam.
you.
Thank you.
Thank you.
Enjoyed speaking to
Okay.
you.